Good afternoon, everybody. It's Matt, and I'm here to tell you all about Chapter 10, Assessment and Intervention for Individuals with Attention Deficit Hyperactivity Disorder, ADHD. Well, this disorder impacts 5.9 to 7.1% of children and is characterized by difficulty remaining on task, lack of attending skills, trouble sitting still, challenges with focusing, frequently exhibiting impulsive behaviors. Functional behavior analysis is used to address socially significant behaviors. So how are these behaviors socially significant? Well, they take place across settings such as home, school, and within the community. This impairs performance in educational, social, and work environments. So how do we diagnose ADHD exactly? An official diagnosis is made with the use of the DSM-5, the Diagnostic and Statistical Manual for Mental Health, 5th edition. The DSM provides more specificity when describing characteristics. There must be a persistent pattern of inattention for 6 months as marked by at least 6 of the following symptoms: making careless mistakes or showing a lack of attention to details, difficulty sustaining attention, not following through on instructions or failing to finish tasks, difficulty organizing tasks, avoiding or disliking tasks and that require a sustained effort, often losing objects, and they are also easily distracted and forgetful. In terms of hyperactivity, also over a period of 6 months, there could be symptoms such as fidgeting in the seat, leaving the seat when sitting is expected, running or climbing in inappropriate situations, inability to play quietly, often on the go, talking excessively, blurting out answers before the completion of a question, difficulty waiting his or her turn, and interrupting or intruding on others. Assessment and rating scales are used for diagnosis as well, and some of the examples are listed here. The one that the book didn't talk about is one that I use, the Behavioral Assessment System for Children, the 3rd edition, and that looks specifically at many different characteristics of behavior, but it gives information on inattention, hyperactivity, and impulsivity with a T-score to tell you if any of these areas of functioning are within an at-risk range or clinically significant. So this is a really nice way of determining whether further assessment is necessary for a child. The problem with these assessments is reliability. It's a rating scale, and a parent a lot of the times is trying to get specific services for a child or even receive benefits if their child displays specific characteristics. So these all need to be taken with a grain of salt, and as a school psychologist, I typically defer to other professionals to give an official diagnosis, even though I am able to give a diagnosis for school-related purposes. So a few facts about ADHD. It impacts approximately 2.5% of children, 4.4% in adults. This disorder tends to persist into adulthood. There is no known cause, but theories speculate that it tends to run in families, and 76% of cases appear to be inherited. In children, diagnosed males outnumber females 2 to 1, but in adults, males outnumber females 6 to 1. Genes related to dopamine transmission and serotonin cortical pathways are related to the disorder. Environmental risks believed to be correlated to the disorder include maternal smoking, low birth weight, abuse, neglect, inconsistent parenting practices, pregnancy and/or delivery complications. So overall, theories believe that it might be a combination of both biological and environmental factors. And though a diagnosis of ADHD impacts individuals at all ages, it impacts people at different stages of their life differently. Children with ADHD tend to present hyperactive. They have delayed development at times, challenges with social skill development, leading to peer rejection, difficulties at home and school, and that all can result in low levels of self-esteem. Once adolescence hits, there is a decrease in hyperactivity increase in inattention, restlessness, impulsivity, which leads to an increased potential for risk behaviors, including criminal behavior, teenage pregnancy, and even dropping out of school. Aggressiveness and antisocial behavior may manifest as well. Antisocial, not meaning being a recluse or a hermit, but not recognizing that other individuals and organisms have rights as living beings. So these are the individuals that would do unspeakable things such as torturing others or animals. In adulthood, the repercussions of ADHD include the list that you see here, which basically culminates to challenges with maintaining one's life and their job. ADHD doesn't just impact those diagnosed with the disability or the disorder, but it can have significant impact on those around them, as like children that have extreme symptoms can cause parental stress, strained familial relationships and marital problems, financial and social difficulties, and siblings struggle as well because all the attention is going to their sibling, and it could lead to feelings of resentment and could be very challenging for the siblings overall. The best way to approach treating ADHD is a multimodal approach, behavioral intervention, and medication in combination. The behavioral approach is where ABA comes into play. So, functional behavior analysis and whatnot, with the goal of increasing academic behaviors while decreasing problem behaviors such as impulsivity and inappropriate behaviors such as aggressiveness. The problem behavior of impulsivity is typically observed when individuals are selecting a smaller, more immediate consequence over a larger delayed consequence. It involves self-regulation and control. Those diagnosed with ADHD will typically choose a more immediate reinforcer, even if the delayed reinforcer is significantly of greater value. The intervention goal would be decreasing sensitivity to the immediacy of reinforcement while making the individual aware of the quality of the delayed reinforcer. And you can do this through delay fadings. Basically, at the beginning of the intervention, you make both the small and larger reinforcers immediately available. And as time continues and the individual picks the item of greater value, you make it more and more difficult for them to attain it by making it you give it to them on a more delayed basis. Inappropriate behavior. This often results in functional analysis because inappropriate behavior is often disruptive and can also be dangerous when the behaviors displayed include aggressive behaviors. We cannot assume that these behaviors are the result of the diagnosis of ADHD, though. The behavior display could be the result of a desire for reinforcement such as attention, escape, or reception of preferred items. Functional assessment is a useful strategy to determine environmental impact. Conversely, a limitation of antecedent or descriptive assessments is that they identify environmental correlations which may not be functionally related to the target behavior. Furthermore, when alternative behavior and extinction for inappropriate behavior are not sufficient, punishment procedures are also an option. So how do we increase academic behavior? Antecedent interventions such as choice making. Task choice is more effective on students who are more sensitive to escape from demands. So you give them options of activities that they need to complete anyway, and then they get to feel as if they are in charge of what they're going to do. Environmental and curriculum adaptations such as preferential seating or the use of white noise may have a positive impact on reducing the impact of environmental distractions. Consequent interventions such as using the PREMAC principle, using preferred activities to reinforce the completion of non-preferred activities might work with some individuals, and then using the token economy, you have an immediate gratification when they earn tokens that also lead to a delayed reinforcer as well. So that is a good way to actually implement the delay fading. Then response cost and timeout are elements of the consequent intervention that might also be valuable. Medications are the most commonly used intervention to decrease the symptoms of ADHD. Stimulants are typically used. They're the first typically sought out intervention. They increase dopamine in the brain and potentially work because the individual is not utilizing behaviors to obtain attention. Their commonly used stimulants include Ritalin, Metadate, and Concerta. They're effective for disruptive behavior and impulsivity while increasing focus and the frequency of on-task behaviors. However, there are side effects such as loss of appetite, sleep disruption, nervousness, and more. Non-stimulant medication has also emerged as an option for those who cannot tolerate the stimulant medications, but once again, it's important to point out that there are side effects including headache, loss of appetite, and gastrointestinal discomfort. As with all situations in which an intervention is implemented, it is important to decipher whether or not what you are doing is actually working. However, this is tricky for ADHD cases due to the fact that it is not appropriate to simply have an individual abruptly discontinue a medication. With psychopharmacological interventions, indirect measures are typically used to estimate effectiveness through parent and teacher reports. In order to truly understand if the intervention is working, we go back to the things we learned in 621, using A-B designs, using a reversal to collect data when withdrawal is implemented. Multi-element is similar to A-B designs, but alternation is quicker. This is a good strategy for fast-acting medications to see if the medications are actually helping with the problem behaviors. It's also important to have an understanding if reinforcers increase desired responding. Finally, functional analysis. Now that an intervention is in play, are there antecedents or consequences that have a stronger impact on the individual? Are there any unintended side effects? For example, now that the individual is able to focus, does peer attention turn to adult attention? Does positive classroom behavior result in an increase in appropriate responding in class? Has attention from teachers transitioned from punishing to reinforcing? So to sum things up, what do we know? What do we not know? ADHD is one of the most commonly diagnosed mental health disorders in children. Significantly more males diagnosed than females. The disorder is possibly linked to a combination of environmental and biological factors. Symptoms of ADHD can be restructured by teaching appropriate responses while minimizing off-tasks or inappropriate behaviors. And ADHD is typically addressed by medication and bolstered by behavioral intervention as well. Now, what do we not know? The specific cause of ADHD beyond theory is not known. The long-term side effects of interventions such as delay fading, we don't know how to consistently generalize this behavior. ADHD is actually on the rise in the U.S. This may be due to changes in the criteria listed in the DSM when they transitioned from the 4th edition to the 5th, but there may also be environmental factors. They do not know the full extent of the long-term effects of stimulant medications. And finally, there are ongoing debates about a possible correlation between stimulant medication use and substance abuse. Thank you for listening. I got a short true-false quiz for you for my activity. See you next time.